Hello everyone, in this video we will be reviewing the frequently asked questions about the musculoskeletal system. Musculoskeletal system consists of muscles, bones, joints, tendons and ligaments. First part of the video we will review the muscular system. Then the second part of the video we will be reviewing the skeletal system. Question number 1. The muscle is attached to the bone by what method? So there are 4 answers available. Please pause the video and find the answer. The correct answer is tendons, aponeurosis and directly to bone. So if you take muscle attachment, all 3 methods are available. The tendons you can see in the picture, they are tough cord-like beds of connective tissue that attach muscle to the bone. Other ones are aponeurosis. They are flat broad sheet of connective tissue that can connect muscle to bone or other muscles, example abdominal muscles. They provide a broad area of attachment. Similarly, direct to bone. In some cases, muscle fibers can attach directly to the periosteum, for example, the membrane covering the bone. But in case of ligaments, ligaments connect bone to bone, not the muscle to bone. So the correct answer is C. Muscle attached to bone by tendons, aponeurosis and directly to bone. Question number 2. One of the 6 major scapulohumeral muscles. A. Temporalis, B. Trapezius, C. Teres, D. Trigone. This type of questions are not common, but in some cases they can appear. So the correct answer is C, that is teres. If you take the scapulohumeral muscles, also known as intrinsic shoulder muscles, are a group of 6 muscles that originate on the scapula and insert into the humerus, primarily responsible for movements of the shoulder joint. These include, you can see here, deltoid, supraspinatus and infraspinatus, suprascapularis, teres major and teres minor. But if you are preparing for AAPC CPC, you no need to memorize these muscles. You can check the ICD-10 CM code book. There you can refer the anatomical illustrations. In the ICD-10 code book, you can see this picture is available. There you can find the teres muscle that is available in the posterior view. That is the musculoskeletal system, arm and forearm muscles. So you can refer this picture as well. Question number 3. The muscular ring around a lumen that is contracted to control flow through that lumen is A. Stricture, B. Snare, C. Sinus, D. Sphincter. So think the answer. The correct answer is D. Sphincter. A sphincter is a circular muscle that normally maintains the contraction of a natural body passage or orifice and which relaxes as required by normal physiological functioning to allow passage of substances. So here you can see in the abdomen there are 2 sphincters. One is a lower esophageal sphincter, other one is pyloric sphincter. This sphincter allows the food movement on one side. Similarly, there are so many other sphincters available in all over the body. You can learn them in the forthcoming videos. When you see stricture is an abnormal narrowing. Snare is a medical device. Sinus is a cavity or channel. So for this question, the correct answer is answer D, sphincter. Question number 4. Main muscle that helps in the movement of the head. A. Hamstrings, B. Facial muscles, C. Platysma, D. Sternocleidomastoid. So pause the video, think the answer. So the correct answer is D, sternocleidomastoid. You can see the sternocleidomastoid is here. The sternocleidomastoid is a large superficial muscle on each side of the neck. It primarily acts to rotate the head to the opposite side and flex the neck. But if you take the hamstrings are in the thigh. Facial muscles are control the facial expressions. This platysma is a broad sheet of muscle in the neck. So the correct answer is sternocleidomastoid. Question number 5. The tibialis anterior muscle controls the finger flexor tendons in the wrist, B. Frontal flexion of the upper abdomen, C. Frontal flexion of the lower leg, D. Forehead furrow lines. So please pause the video and think the answer. For this question, you can easily find the answer by the name of the muscle. You can see Tebialis anterior. So Tebialis means there's a bone in the leg called tibia. So it should be in the leg. So correct answer should be frontal flexion of the lower leg. So let's see the explanation. So the correct answer is C. You can see here, this is the tibialis anterior muscle. It originates in the lateral shaft and condyle of the tibia and insert into the medial cuneiform in the base of the metatarsal. So this tibialis anterior is a muscle in the anterior compartment of the lower leg. It primarily acts to dorsiflex, that is frontal flexion of the lower leg, to lift the foot towards the shin. Question number 6. The three types of muscles are smooth, skeletal, and A. Compact, B. Cardiac, C. Contractile, D. Flexion. So it's an easy question. So the correct answer is B. Cardiac. So there are three types of muscles you can see in the picture. One is cardiac muscle, other one is skeletal muscle, other one is smooth muscle. The skeletal muscle, that is the muscle attached to the bones responsible for the movement. Smooth muscle found in the walls of the internal organs, example digestive tract and blood vessels. Cardiac muscle is the muscle found only in the heart. Question number 7. Which of the following is the type of muscle that is found in the heart? A. Skeletal muscle, B. Smooth muscle, C. Cardiac muscle, D. Striated muscle. So this question also repeatedly coming as in the question number 6. So we already have seen that this is the muscle found in the heart is the cardiac muscle. So the correct answer is cardiac muscle, as I explained earlier. The question number 8. Which tendon is commonly involved in the rotator cuff injury? A. Biceps brachii, B. Triceps brachii, C. Supraspinatus, D. Pectoralis muscle. So pause the video and think the answer. So the correct answer is supraspinatus. So rotator cuff is a group of 4 muscles that is called sits muscles. So sits, S-I-T-S means S. Supraspinatus, I. Infraspinatus, T. Teres minor, and S. Suprascapularis. So the supraspinous tendon is the most commonly injured in the 4. You can see in the picture the supraspinous muscle is teared here. The supraspinatus tendon is normally getting tear when the rotator cuff injury occurs. Question number 9. The Achilles tendon connects which muscle to the calcaneus, that is heel bone? A. Quadriceps femoris, B. Hamstrings, C. Gastrocnemius and soleus, D. Tibialis anterior. So please pause the video and think the answer. So the correct answer is gastrocnemius and soleus. You can see this is the Achilles tendon. It connects the gastrocnemius muscle. There are 2 muscles, medial and lateral. With the soleus muscle, it forms this Achilles tendon. The Achilles tendon, that is the calcaneal tendon, is the strongest tendon in the body. It connects the gastrocnemius and soleus muscles, calf muscle, to the calcaneus, heel bone, allowing for plantar flexion of the foot. Question number 10. The wave-like contraction of smooth muscle that moves substances through tubular organs, such as the digestive tract, are known as A. Peristalsis, B. Vasodilation, C. Homeostasis, D. Ossification. So please pause the video and think the answer. The correct answer is A. Peristalsis. You can see the peristalsis is the rhythmic wave-like construction of the smooth muscles that propel substances through the various tubular organs, most notably the esophagus, stomach, and intestines in the digestive system. Here you can see the peristalsis movement of the digestive system that propels the food bolus through the digestive tract. Question number 11. Which type of muscle tissue is primarily responsible for voluntary movement of the skeleton? A. Cardiac muscle, B. Smooth muscle, C. Skeletal muscle, D. Visceral muscle. The correct answer is C. Skeletal muscle. Skeletal muscle is unique among the muscle types for its voluntary control and attachment to the bones, facilitating conscious body movements. But cardiac and smooth muscles are involuntary. Question number 12. What is the primary difference between a tendon and a ligament? So it's a common question. So please pause the video, read the answers, and find the answer. The correct answer is tendon connects the muscle to bone, while ligaments connect bone to bone. you can see in the picture, this is the tendon. This tendon binds the muscle to the bone. But ligament, you can see, it is connecting bone with the bone. Question number 13. Which term describes the movement that decreases the angle between the two body parts, such as bending the elbow? A. Flexion. B. Extension. C. Abduction. D. Adduction. So please pause the video and think the answer. The correct answer is flexion. You can see in the picture, this is abduction. Abduction moves closer to the midline. You can see the hand is coming towards the midline is called abduction. Away from the midline is called adduction. But here, flexion is when you bend the hand, that decreases the angle of the joint is flexion. Extension is increases the angle of the joint. So in our case, the question asks the movement that decreases the angle between the two body parts. So the correct answer is A. Flexion. Question number 14. Which of the following muscles is primarily responsible for flexion of the elbow? A. Triceps brachii. B. Deltoid. C. Biceps brachii. D. Pectoralis major. So pause the video and think the answer. The correct answer is biceps brachii. So if you want to flex the elbow, the muscle should be in the anterior compartment of the upper hand. So you can see the anterior muscles of the upper hands are deltoid, pectoralis major, biceps brachii, and triceps brachii. So the main muscle responsible for the flexion of the elbow is the biceps brachii. So correct answer is C. Question number 15. Besides movement, muscle contraction also plays a significant role in which of the following homeostatic function? A. Digestion of carbohydrates. B. Heat production. C. Urine formation. D. Hormone synthesis. So please pause the video and think the answer. So the correct answer is heat production, because the muscle contraction generates the heat as a byproduct, which is essential for maintaining body temperature, especially during the physical activity. So if you are in a cool climate, you will get shivering. The shivering is an involuntary muscle contraction that increases the metabolic rate and heat production to warm the body when cold. Question number 16. Which muscle is the primary muscle of inspiration, separating the thoracic and abdominal cavities? A. Intercostals. B. Diaphragm. C. Pectoralis minor. And D. Sternocleidomastoid. So it's an easy and straightforward question. So the correct answer is B. Diaphragm. So when you see the thoracic cavity, in the thorax you will have the lungs and heart. On the abdomen you will have the small and large intestines. So between the thorax and abdomen, this middle part, this middle muscle, that is diaphragm, separating both the thoracic and abdominal cavity. Question number 17. Which muscle group is responsible for the extension of the knee? A. Hamstrings. B. Gastrocnemius. C. Quadriceps femoris. D. Gluteus maximus. So please pause the video. So if you have doubts, you can take your IC written CM books with the anatomy illustration on the front part. Then you can find the answer. The correct answer is C. Quadriceps femoris. So the quadriceps femoris is the primary muscle responsible for the extension of the knee. So when you see the quadriceps muscle, it will actually contain four muscles: the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. So these four muscles bind together to form the quadriceps muscle. But when you see the hamstrings are responsible for the flexion of the knee. But here the question asking for the extension. So extension is quadriceps femoris, flexion is the hamstring muscles. Question number 18. In muscle anatomy, what term refers to the stationary or less movable attachment point of a muscle? A. Insertion. B. Origin. C. Belly. D. Head. Think the answer. The correct answer is B. Origin. So when you see the parts of the skeletal muscle, you can see this part is the origin. So origin is attachment to the stationary end of the muscle. The middle part is called belly, that is the thicker middle region of the muscle. Insertion, you can see insertion is the attachment to the mobile end of the muscle. So less stationary or less movable part is the origin, and the more movable part is the insertion. For this question, the correct answer is B, origin. Question number 19. What type of movement involves turning a bone around its own long axis, such as turning the head to look left or right? Answer A is circumduction, B rotation, C pronation, D supination. So think the answer. The correct answer is rotation. When you observe this picture, you can see the rotation is move the bone around its own axis. Pronation is turns the palm downward. Supination is turn the palm upward. Question number 20. What is the connective tissue layer that surrounds the entire muscle? A. Endomysium, B. Epimysium, C. Fascia, D. Perimysium. So pause the video and think the answer. The correct answer is B. Epimysium. So epimysium, you can see in the picture, this is the epimysium, and here you can see this is the perimysium, and this is the endomysium. So the epimysium, it is the outermost layer and helps to hold the muscle together as a distinct unit. Endomysium, you can see inside, it surrounds the individual muscle fibers, that is cells within a fascicle. Perimysium is, this is the connective tissue layer that surrounds the bundle of muscle fibers. So these are the MCQ questions for the muscular system. My channel offers guidance for the medical coding, especially to help you to prepare for the AAPC CPC examination. If you have any issues, please feel free to ask me. You can leave your questions in the comment sections, or you can email or WhatsApp me using the details displayed here. If you feel this channel is useful, please subscribe my channel and stay with me. Thank you.